My name is Vivian Fan, and I'm the Director of Public Health Programming for this year's conference. Welcome to the Careers in Public Health panel. In this session, you will learn about various health career options that are available within the public health field. Each representative will expand upon their own careers, their personal career journey in public health, and the benefits of working within the field. If you have questions you would like to ask the panelists, please wait until near the end of the session. Let's have Ms. Czarina Behrends start the panel off by giving a quick introduction of herself, and the rest of the panel will do the same.
Hi, my name is Czarina Behrends, and I'm an epidemiologist at the California Department of Public Health in the Office of AIDS. I have a master's in public health, and I'm a newly minted PhD in epidemiology.
Hi, my name is Allison Mangiaracino. I am a recent graduate of the UCLA School of Public Health from the Department of Health Policy and Management. And now I work at Covered California as a health plan quality and networks analyst.
Good afternoon. My name is Caroline Peck. I'm a physician and a public health practitioner, and I work at the California Department of Public Health in the Chronic Disease Control Branch.
Good evening. My name is Mauricio Rodriguez, and I work for the Center for Reducing Health Disparities right there at the UC Davis Medical Center. I graduated in 2012 from Drexel University, and currently I'm working on Covered California as well. I'm doing some Covered California work and also some program evaluation too.
Good afternoon. My name is Rob Simmons, and I direct our public health program at Thomas Jefferson University School of Population Health in downtown Philadelphia. But I'm a native Californian, Don Lyman. I've known for 30 years, and have experience San Diego County, California Department of Public Health, MPH at Loma Linda University School of Public Health, doctorate in public health at UCLA School of Public Health.
Does it snow in Philadelphia?
Occasionally.
Yeah. We haven't had any snow here. We haven't even had any rain here. So I'm John Troidl, and you know it's kind of funny because I'm looking at my name tag on the back and it's upside down. So I'm gonna try not to get disoriented. I'm John Troidl. I have an MBA in finance with an emphasis in healthcare and a PhD in health services and policy analysis. I teach, I consult, and occasionally do some research. I do some policy advising. I was on the California Health Workforce Policy Commission for 10 years, so I know a few things about workforce.
Thank you, panelists. So we'll start the panel off with the question, how did you know you wanted to pursue an MPH? Did you have a particular career in mind back then?
Well, for me, I kind of took a non-traditional route. I started a PhD in epidemiology here at UC Davis, and about a few years in, I decided I wanted to do an MPH. And part of that was I entered into my PhD epidemiology program having no prior knowledge of public health or how epidemiology fit into public health. And it wasn't until I started TAing for Dr. Troidl down here at the end for an intro to public health course that I started to really see that I was kind of missing all these other pieces and how I fit into all of those other pieces. And so I decided I want to get an MPH to sort of broaden my sort of knowledge of public health and to be a better collaborator with other areas of public health, and to also really just do better research. I wanted to do research that really connected with policy and program recommendations. And so I think understanding who you're partnering with really helps in sort of developing those bonds and working with people once you kind of have a sense of where they're coming from. So that's part of the reason why I decided to get my MPH.
Well, I arrived at public health by way of the liberal arts, so I was a political science major in undergrad, and I've always been interested in power and government and who's in power and how they make decisions. And then, you know, within politics, within policy, of everything I could do, I was the most interested in health. So after undergrad and after doing a stint in the Peace Corps, I ended up in public health, and I really enjoyed it, but at the time I was working in infectious diseases and wasn't really sure how I fit in, and again, with an interest in government, I wasn't sure how I could apply that to a setting in public health, but I ended up taking a class taught by Dr. Behrends and Dr. Troidl, an Intro to Public Health course, which really laid out fundamentally what public health is, and the most important thing I learned from that class was the definition of public health, and from then on it's been kind of my own personal mission statement. So that's when I decided that I wanted to go to graduate school and study health policy and management. And I think at the time, and still my interest is in access to care and the safety net, and specifically healthcare reform implementations. So I decided to pursue health policy and management in order to achieve that goal.
I received my MPH as part of my second residency, the General Preventive Medicine and Public Health. And that was a specialty I hadn't even heard of when I was going through medical school. I finished medical school and became an OBGYN and was practicing for 4 years. And it was through that experience doing clinical work on the Navajo reservation that I became very interested in a more population-based approach. And the Masters of Public Health was the first year of my second residency.
Yeah. I was raised in Edmonton, Alberta, Canada. Believe it or not, I moved to Los Angeles because I wanted to get into acting. After that, I moved to Fresno, Central Valley, and I was living next to the chair, he was the chair of Fresno, the public health, community health program, and he took me for a ride to a couple of underserved, underrepresented areas, and he took me to his office, and he said, you know what, you really have a responsibility, being, a bicultural, bilingual individual, a person of color, to be in this situation. You really have to give back to your community. So he took me around. He showed me a couple of the areas that were really underserved. He took me to his office, and I made the contrast, and I was sold. Basically, I just followed his footsteps, and that's how I got into to do my MPH with that.
Mario, that's a great story and about that. So my background was education. My undergrad was at UC Santa Barbara. It was a gaucho down in Southern California, and I was a first grade teacher in 1970. After being in the classroom, I felt I wanted to combine my education, but I wanted to get out of the classroom. And I actually was working in Tecate, Mexico, across the border. And I wrote away to, at the time, called HEW, Health, Education, and Welfare, when the Department of Education wasn't a department yet. And I received a brochure. I wish I had kept it, because it talked about public health and public health education. At that time, in 1970, early 71, there were 13 schools of public health. There's now, between schools and programs, just accredited ones, something like 160. So what an opportunity for all of us in that field. So that's how I heard about it. I combined my background in education and my personal interest in public health and the field of behavioral sciences and health education.
Okay, so I'm going to let you in on a little secret. I don't have a master's in public health. I have an MBA. And the way that I came upon that was I was getting my undergraduate degree in biology at Brown. I was pre-med, and I was working my tail end off. School was tough. And I was thinking while I was working hard, I said, I don't know anything about being a physician. And, here I am, I'll finish my undergraduate work, go to medical school for 4 years, do a residency program for at least 3. So at that point, I was looking at my senior year in college, 4 years in medical school, 3 years of at least 8 years more training, without really having a good handle on whether that was the profession for me. So what I did is I took a year off from school. And my oldest brother told me about the Vanderbilt Student Health Coalition, which was a program based at Vanderbilt that did community organizing around healthcare. So I got a job there. I worked there for the year, and I encountered the community health center model and alternative careers in healthcare. So I did, as I've been known to tell my students, sometimes it's good to be obsessive compulsive. So just kidding. I did, over the course of 2 years, I did 200 informational interviews with different people working in healthcare. and asked them what they liked about what they were doing, what they didn't like, how they were prepared, what they would do differently. And I tried to explain a little bit about me, and if they were me as a young person, what would they do? So a lot of people said, if you want to help healthcare, go get a master's in business administration, because healthcare is a mess and it needs better organization, better management. So I listened to that advice. I went back to school. I finished up my biology degree. I started taking econ and accounting, and I liked them. So I applied to business schools, and I was accepted at UCLA, and they allowed me to defer for 4 years. So I went down to DC to explore federal involvement in healthcare, and then I'll tell you later with the additional questions about what else happened, but I ended up getting a PhD in public health. So I do have public health training. It's just not at the master's level.
Thank you, Dr. Troidl. So next question that I would like all of the panelists to answer is, can you spend 3 to 4 minutes talking about the career that you currently have and how you came to it?
Well, currently I'm working with the California Department of Public Health in the Office of AIDS. I'm a research scientist there. And I actually came to working there once I started out my PhD in epidemiology. They had a pilot study there on peer-mediated syringe exchange in order to prevent HIV amongst injection drug users. And I really fell in love with that type of research. It became my dissertation. It became a focus of the research I've been doing. And a lot of it had to do with, I guess, my desire to work in research that really addressed the whole idea of social justice. And this is a group that is disadvantaged and disproportionately affected by HIV, and it sort of really spoke to what I wanted my research career to be about. And so I've been dedicated to working in HIV throughout the entire time I was in my PhD program. Part of that was because the funding for the study that I initially started working on at CDPH got cut. But I wanted to continue doing research in that area. I continued working at CDPH doing health disparities work with them. So my position sort of evolved. I made myself useful in a lot of different ways by working on projects that were important and that really spoke to the sort of research I was interested in. And one of the sort of interesting aspects of sort of my PhD career is that I was working at the state while I was doing my PhD, and that's pretty rare for a lot of PhD students. Usually they end up working with someone who has a grant and they just do their dissertation research and that's it. I did my dissertation research separate from the research I was working on at CDPH. But I think what was useful about that was during my PhD, I was able to really bring a lot of what I was learning into sort of, applying that to real world problems. And I think that was really useful in sort of helping bring all of that I was learning into context of how I could really make an impact with the type of classes that I was taking or with the type of research that I was doing. And to sort of connect that to public policy and to making program recommendations. And really at the state, that's the focus of the research. It's used for making decisions and really targeting programs that are going to be effective. And so I think that has been really useful in sort of my research career. And I've continued down on this path and we'll be working with the Office of AIDS in the next year while I work on looking at postdocs. But it's been a really good experience for me, kind of combining those two worlds.
So I started my journey to cover California 2 years ago, almost exactly 2 years ago when I started my graduate program in public health. When I entered the school, I knew I wanted to do access to care, healthcare reform implementation, and the safety net. So while I was getting my education, I was trying to imagine where I would be in 2 years. So I started a running list of organizations that sounded interesting to me, and by the time I started my second year of grad school, I had a list of about 20 organizations I was interested in. And I grouped those organizations according to kind of their area in policy and management. So some were state agencies, some were federal agencies, some were trade associations and nonprofits and advocacy, and then some were foundations. So as I was thinking about where I wanted to end up, I thought about those 3 different settings and sought out professionals in those settings to get a sense of what they do in their day-to-day work. And so when I was in my winter quarter of grad school, I came up to Sacramento because I knew I wanted to live in this area. And I did 16 informational interviews from people in state agencies and foundations just to get a sense of where the opportunities were. And I think in all of those conversations, I started in my mind thinking that, you know, healthcare reform is really where I want to be. This is something that's going to be happening in decades from now in terms of reforming the health system. And ultimately, I found an opportunity at Covered California, and it really aligned with where I wanted to take my career. And I applied. I had the help of mentors who were able to help me make the right connections and ended up there. So that's how I ended up at Covered California.
So once I finished my general preventive medicine residency at the California Department of Public Health, I actually was able to land a job there. And I was working for the Every Woman Counts program, overseeing the CDC grant for breast and cervical cancer screening. I took about almost a year and actually went to work for the local health department, Sacramento County, under Dr. Glenna Trochet. And that was an invaluable experience for me, seeing as I'm now at the state, because it gave me an insight into what public health work is done at the local level and the challenges they faced and the type of jobs that everyone has there. And so while there, I was the maternal child adolescent health director, as well as overseeing the child health disability program, and that is a safety net program for children, and which is now, as part of healthcare reform and Medicaid expansion, is kind of morphed over and is become part of the Department of Healthcare Services, working very closely with Medi-Cal. So I then was recruited back to come and work for the state health department to oversee the preventive medicine residency program, so the program I'd just gone through, as well as the CAL-EIS fellowship. And that is a training program for MPH level graduates who are interested in working in a local public health or a state public health department, but who need a little bit of experience, not only to get a job, but to really see where their skills might be best utilized, where they would be most interested in working. So I did that for probably about 5 years, became a section chief when my boss left, and then was asked to apply to become the branch chief director, which I did. And so I've been in that role for about 5 years now, and I oversee the programs for heart disease, stroke, diabetes, Alzheimer's, arthritis, colorectal cancer, oral health, and then our 2 training programs. So it's been a wonderful experience, and I work closely with the branch chiefs for tobacco control, nutrition, cancer, and physical activity and injury.
Yeah, I was doing my internship in Boston as soon as I graduated as part of the pre-doc scholarship. They funded me to be over there in Boston. My wife was accepted at the UC Davis School of Medicine, so I followed her over here. I knew that the School of Education for Medicine was on campus, so I knew that I wanted to be there. So I started applying, and unfortunately I met Dr. Latson Hinton. He interviewed me for one of the positions, the Men's Health and Aging study. He was a very great individual, took a chance on me. I worked with him for 2.5 years, and then when my daughter was born, I took a break, which I thought was going to be more than 10 days, but there was another project that they told me about from the Center for Reducing Health Disparities. I'm sorry, for the Center for Healthcare Policy and Research, Teresa Farley's department. So I joined that team, and now I'm currently with the Center for Reducing Health Disparities with Dr. Aguilar Gaxiola, who also was working with Dr. Latson Hinton. One of the things I'm noticing is that with public health, there's a lot of soft money, so I'm working on various projects, but I'm coming across a lot of people that I worked with in the past. So I've worked on multiple projects as well, and I'm there at the medical center at UC Davis too.
Okay, so I left off at, I went to from Mexico, I went to Loma Linda University School of Public Health for my MPH. And I'm going to try to do this very quickly. I then got a great job to start my career at San Diego County Department of Public Health, both in North County and down in San Diego with the healthcare agency and a number of things. Decided to go in the Peace Corps, so went to Colombia and spent 2 years there. Then also worked for the Latin America division for a year and doing training throughout Central and South America. Met my wife, una colombiana, that this is our 36th year together. And so that I gained a lot more than I think I gave. I then came back to Los Angeles and worked for the American Lung Association as the program director while I was getting my doctorate at UCLA. I'll just highlight many things, but the one thing I want to focus on is I was stationed for 18 months, paid for by the National Office of Lung, same with Cancer and Heart, for working on Proposition 99. You may not have heard about it, but look it up, 1986 through 1988, the first major initiative beating the tobacco industry. 25-cent tax on tobacco, not a big thing. At that time, it was huge, generated $600 million, earmarked entirely for public health. 20% of that, 120 million, went to tobacco control, which would then use to form the infamous tobacco control program in California, which has been the leading program in the nation. And then as part of that, after finishing my doctorate, I was up in Northern California. I actually worked for San Francisco Foundation, also the California Wellness Foundation, so private foundations are another great source. And then worked for, I don't know if it exists anymore in the state system, it's called the Office of School-Linked and School-Based Health Services. I was positioned both in the Department of Education and in the department at that time called Health Services, now Public Health, dealing with school-based wellness centers statewide. And from there, moved east, worked for 8 years at a healthcare system called Christiana Care down in Delaware. And then more recently got into academia, Drexel School of Public Health in Philadelphia, and then my final position currently as the Director of Public Health at Thomas Jefferson University in Philadelphia.
Qué bueno que aprendió español, así que se casó con una colombiana.
Así como no, una paisa.
So where I am now goes back to that year I took off from school and did my career strategic planning. I have a professional mission statement that I developed then and have followed ever since. So it's been very useful in guiding me, and that is to obtain the education and experience so that I can be useful to community health centers and other community-based organizations, and to provide advice to business and government about how to do healthcare. So I went back to college. I finished up my degree, like I told you. I moved down to Washington, D.C. to explore the federal involvement in healthcare. And when I was there, I saw that the people who were influential in healthcare were MDs, PhDs, or JDs. So PhDs is the one I was most focused on. So I worked there. I had my admissions from UCLA in my filing cabinet. And I worked for a consulting firm that provided management consulting to community health centers across the U.S. So I got to travel and I got to be helpful to community health centers right away. And then I had an elevator ride one day with a person named Gene Phillips. Now, I'm bad at remembering names, but I try really hard to remember my teachers. And in the course of an elevator ride from the 9th floor to the street, Gene Phillips suggested to me, she said, you know, John, I'm hearing good things about you. You're working hard, you're a smart young man, and you're doing some good consulting work for us. But have you ever thought about going to work at a community health center? Because as consultants, we just kind of go in, we provide advice, and we leave. And you haven't had the experience of working in a health center where you have to take the advice, use it, implement it, and then live with the results. And to then establish a feedback loop of trying to do better the next time in case that didn't work optimally. She said, but that'll make you a better consultant in the long run if you've had experience in working in the environment to which we're providing advice. That was all in the course of one elevator ride. So when I got down to the ground floor, it was like, wow, that was a good idea. So I started asking around about health centers that might need somebody to work there. And I was told about a community in southwestern Virginia that had a planning grant to establish a community health center. So they had a piece of land, a board of directors, and I think it was a $90,000 planning grant. So I went and talked to them, and I ended up interviewing with them, and they hired me to put together a community health center from scratch. So as I tell people, we had great success together. In 3 years, we put together a community health center. Some of the things I learned by the forehead method. And the forehead method is running straight head full speed into a brick wall and going, boink, that didn't work. And picking myself back up and going, I got to find a different way to do that. So after helping that community set up the health center, I contacted the Dean of Admissions at UCLA and said, I'm finally ready to come attend school. So I went to school at UCLA, thoroughly enjoyed living in Los Angeles. I had a good time. But the business program there is terrific. And I took about half a dozen classes over in the School of Public Health, because as a grad student, you can do that. So I was combining public health and management, and graduated from there and went to work for an information systems consulting firm that helped hospitals acquire computer systems to do both better billing and also better care. And then I worked in a number of other positions in healthcare, and I started teaching part-time at Sac State. I taught a strategic management class and found that I really enjoyed teaching. So I knew it was then time to seriously consider going to the PhD program. And I applied to a couple programs, and actually I applied to 2. I applied to UCLA and to Berkeley. I was accepted at both, and then did the pros and cons and ended up at Berkeley, and I got a PhD in health services and policy analysis. I continued doing my consulting work when I was in school because I was helping support myself from school. So in the mid-90s, when I was in my program, I had about 3 years of consulting work in Hawaii. I helped community health centers there. I helped community clinics become community health centers. But I couldn't tell my classmates in my PhD program that the reason I was absent from time to time is because I was in Hawaii, because I didn't want to make them jealous. So I finished up my PhD there, and I have continued to do teaching, consulting, and research. I used the PhD for the research and consulting. I used the MBA for I used the PhD for teaching and research. I used the MBA for the consulting, and I used both for, as I mentioned, I was 10 years on the Health Workforce Policy Commission, and that's providing advice to government on how to do healthcare workforce development. So the MBA and the PhD give me lots of flexibility to make a contribution in different ways.
Thank you, Dr. Troidl. So next question is, what areas of public health career-wise do you see changing in the near future? So what areas of public health career-wise do you see changing in the near future?
Is that for all of us?
Oh, it's open. Go ahead.
Okay.
Yeah.
So the thing that CDC is asking us to do in public health that we have not done before is work with healthcare systems, like seriously work with them, and also engage in electronic or health information exchange and electronic exchange of information. And so there are, for example, at UC Davis, they have part of, you can do an MPH with a focus on health informatics. So that's just one idea. And so people like John Troidl are very useful to us because we have to start speaking the language of business, which is return on investment and, which is new for us. But I think public health has a lot to bring to the table for business. We have a lot of great interventions. So that would be my suggestion.
I'd just like to follow up with that. Certainly, our School of Population Health, and you may have heard the term population health, it's really a meld between public health and the healthcare system, so very much so. And I just want to use one example within the, and I always refer to this as the Patient Protection and Affordable Care Act. There's so much wonderful public health patient protection, but get lost in the discussion about insurance all the time. So as part of that, that's required. I hope all of you know of it because it's a great opportunity. It is a requirement of every nonprofit hospital nationwide to do every 3 years a community health assessment and implementation plan, and then engage people with prevention and public health experience in the implementation of that plan, including students. So it's a wonderful opportunity anywhere in the country to work on those plans. San Francisco, at least in California, from my perspective, San Francisco has an incredible plan. What a coalition they've put together. Chicago has been also a model. Here in Philadelphia, in the city where I'm at, also a great model. It's in every single community where there's a nonprofit hospital. So look at skill sets, community health assessments, looking at both needs and assets, doing various interventions, evaluation. These are all opportunities for you, and it is permanent in the Patient Protection and Affordable Care Act. So please contact your state Medicaid directors and offices, managed care organizations, and also all of the nonprofit hospitals to see how they're doing. Maybe they need some assistance. We talk about potential full employment. That's, looking at John, that's a real potential with some strong skill sets in community health assessment.
If I can reiterate essentially what people have said and then what Allison and some others will say, which is that whole data side of things in public health, it's a brand new day. And my estimate is in 10 years, we are going to have a revolution in public health because of the availability of broad and deep data. So those of you that are looking at career, your timing is beautiful. Your timing is exquisite. If you have an interest in epidemiology, biostatistics, data, mathematics, or on the utilization side in health management, your timing is exquisite. And I would become comfortable, if I were you, with using statistics and with using statistical applications on computers. The other thing I would say is a big change is the triple aim. And the triple aim is the mantra of CMS. How many of you know what CMS is? Raise your hand. Okay, most folks don't, so this is the typical answer I get. CMS is the Center for Medicaid and Medicare Services. You'd think they would have two M's, right? CMMS, but they go by CMS. I guess there's an overlap of one of the M's. They, Medicare, Medicaid, and Child Health Program, they pay 55% of the healthcare dollar in the U.S., so they're the biggest purchaser of healthcare. And they say the triple aim is our goal, and the triple aim is improved quality, leads to lower cost, and together they improve the health status of the entire population. And they say we have to do all three at the same time. Previously, in the last 50 years, what we've tried to do is one at a time. You know, we sometimes put an emphasis on cost, we sometimes put an emphasis on quality, and CMS, through the leadership of Dr. Don Berwick, another one of those thoughtful pediatricians, Don Berwick said, nope, we got to do them all at the same time. So the challenge is cost, quality, and overall health status at the same time. And it's the first time that we've had an integration, a formal integration, besides the Community Health Center program, of public health and health services in a policy way. So that cost and quality are health services. The goal of improvement of health status of populations is public health. So the three of them are integrated together. And that's a major change impacting all of us. The triple aim.
Thank you, Dr. Troidl. Mr. Mauricio, I'm sure a lot of students are wondering this, but is it possible to work in the public health field without a degree in public health?
I think it's very important to have a degree in public health. I know that my experience has been that when I graduated with my bachelor's degree in community health, I was already at the UC Davis Medical Center, but I started to see that there was a trend that if you want to do some type of project management, everybody at the Center for Healthcare Policy and Research had an MPH. So I went from collecting the data, and I want to do more of like the project management, analyzing it, program evaluations. So it was very essential for me to have an MPH. So during my time working at the UC Davis Medical Center, I was also doing my graduate studies, and it was very essential to have an MPH. And because of the MPH, it's opened so much more opportunities. Instead of just doing the initial data collection, you know, I can be put in a position where I can do program evaluations because of what it's gotten me.
Hey, can I add a little bit to that?
Sure.
Okay, just real quickly, 80% of the people that work in public health have never been trained in public health. They've not had a minute of training in public health. And what's happening through younger professionals like Mauricio, because you are younger, is the workforce is being converted to people who are trained in public health. So currently, only 20% of the people working in public health have been trained in public health. In the future, the number is going up much higher, and we hope to see all of you doing that.
Thank you. Ms. Mangiaracino, what do you think is the most rewarding part of choosing a career in public health?
I think the rewarding part of it is feeling like I'm doing something to mitigate my outrage. Because I think what I would say many public health professionals are motivated by is one part outrage and one part or two parts optimism. And I think I'm outraged that we spend 17% of our GDP on healthcare, and we get very poor value for that. I'm outraged that the life expectancy of African American males in Los Angeles County is 69, while average life expectancy is 78. And I'm outraged that there are people who need a basic preventive health service who can't get it. Or have a health condition that they're putting off care because they don't have access or they don't have insurance. And so it's those things that really kind of motivate me. And I see people on this panel and people in this room who are optimistic, and I'm optimistic as well. We're going to do something about it, and I believe we can do something about it. So I think that's the most rewarding part of being in this field.
Thank you, Ms. Mangiaracino. So that is our last question for this panel. But there's another Careers in Public Health panel. It will be 5 to 5:45 in Rock or Chem 179. If you'd like to continue to listen more about careers in public health, we'll be asking a few different questions, and you'll also have a chance to ask the panelists this question as well. Can you please give a round of applause? Thank you.
For you. Yeah, I think I want to add just a little to that when you mentioned about alumni, because we have a tremendous alumni network around the nation and around the globe, and even though Ohio State or Columbia or wherever might be far from California, you know, don't be afraid to ask if there's an alumni in your area who you could sit down with, not only to find out about your school of interest, but to do some informational interviewing and talk with them about their career and how they got to where they are in the field, because I think you can learn a lot from those who have sort of come before you in public health, and that doesn't mean your path has to be the same as theirs, but it can give you an idea of the diversity in terms of careers and of, you know, just journeys you can take in the field.
I'm going to do a little bit more practical like Jan did, and this is for letters of recommendation, because this is a big piece of your puzzle. And your application should be, think of it strategically. You're going to give us data, you're going to give us your personal story, but then these letters of recommendation should really reaffirm everything else. So someone else is telling us, yes, she does have that passion, or yes, they were an amazing student, even though the GPA might be up there. So make sure you look at it strategically. So what I'm going to say, basically, for us, you have 3 letters of recommendation. What I would do is go into the person, make sure you have a very strong personal relationship with them, and ask, do you know me well enough to write an outstanding letter of recommendation? And use the word outstanding because it puts it out there that you want a really good one, right? And then you're going to give them your personal statement, you're going to give them your resume, you're going to give them a little bit about the school you're applying to, and if Betsy, Rachel, and Jan are my letter recommenders that I've asked, I'm going to give Betsy 3 bullet points. Would you please talk about these 3 things that you know about me? Rachel, would you talk about these 3? Jan, would you talk about these 3? But what I've done is I've crafted and I've given separate ones to each person. So now my faculty who's reading my application has 9 different bullet points. Because if you don't help guide them, they'll all write kind of the same letter. And I just want you to be able to look at strategically look at your application, like, now who needs to reaffirm which pieces? And help guide them. As a letter writer for 18 years getting you all into these programs, it helps to have bullet points, believe me. And if they don't agree, they won't write it. But 10 to 1, if you have a good personal relationship and they know you well, they'll write it.
So I agree with everything that everyone has said. And my words of wisdom, I guess, don't let people talk you out of it. You know, when you're pursuing professional programs, so you go to medical school and you know you're going to be a doctor. You go to law school and you know you're going to be a lawyer. Public health, because it's so broad in scope, it's hard to define. And I think sometimes when you tell your parents or your friends, I'm going to go get a Master of Public Health degree, they're like, what? What are you going to do with that? You can do a lot, as all of my fellow panelists have said. It's a really booming field. It's very exciting. There's a lot of opportunity. We need trained public health professionals, so don't let anybody steer you in a different direction. If public health is your passion, that's what you should follow.
Thank you, panelists. Does anyone in the audience have any questions they would like to ask? Yes, go ahead.
This question is kind of directed toward Mr. Clark, just consistently smart. It's kind of just regarding the dual degrees between MPH and JD. So I can see pretty clearly how something like an MPH in public policy or something relates directly to law. I just don't know if there's a link or a link that I don't see between one of the more science-oriented MPHs. I get a lot of one of the focuses is common science, environmental health science, and that one's a little more of like the natural biological sciences. So does something like that have a strong connection to? I'm just wondering why there's a dual degree with the JD. Like, what sort of thing would do that? Would you use the knowledge of both degrees?
So, well, we don't have that yet, but we're working on it. But you know, there's a number of areas you could think about. Environmental health and the issues. When I think of our state right now, we have issues around environmental health and oil and gas exploration. We have issues around. We now have marijuana legal in our state, so we have a number of different areas. Things that intermix with health and marijuana. So there's a number of different areas across public health where law really would be a great combination. So those are just a couple off the top of my head.
A couple that just graduated this year. Eli went back to Washington, D.C. He wants to do public health law, but he wants to do it on Capitol Hill, so he's working for our senator right now doing that. We have a woman who just graduated. She was very concerned about reproductive health and abusive situations for women. So she's doing it from the legal standpoint. We have some students right now, I don't know if y'all know, but the San Fernando Valley is the porn capital of the world. So our students have been trying to get the porn industry to add condoms into their every single shoot, and they took it from the public health perspective of, that's just the right thing to do, you shouldn't spread disease. Well, the law students came together and said, wrong tact. The tact is, you're not protecting your workers. So they took it from the legal standpoint of a workers' rights issue, and they passed the law, and now in Los Angeles County, you have to wear condoms during the porn industry. So that's kind of like taking law to use for public health purposes.
Thank you, Mr. Clark, and thank you for your question. And I would like to conclude the panel by thanking the panelists. You're welcome to come up to the panelists. I'm sure they'll stay for a little bit to ask your questions. Please give them a round of applause.